Hi, good morning. This is Chris with Denver Wellness Digest. Today joining us is Jasmyne Kettwick, a therapist from Relate Family Therapy and Counseling. She was gracious enough to join us today via Zoom. And Jasmyne, thank you for bearing with our technical difficulties and for being here today.
Thank you. I'm glad to get to talk to you finally.
Yes.
Yeah.
So I invited you on today because I was reading a couple articles from Forbes and from Psychology Today about reasons why therapy might not have worked for you in the past. And I think this is probably something that you experience a lot, or you talk about a lot, I would assume. And it's something for me that is really important to the general public to realize. Just because you've tried therapy in the past doesn't mean it's not worth revisiting.
Mm-hmm. Yeah, that is something that we talk about at Relate a lot, because one of the things that is a milestone for our clinic is that if you've tried therapy in the past, try it again. We might have a different approach. We might have a different type of clinician. And I want to hear why it didn't work in order to help you find a better fit.
Great. That's a really important point. I think that's a great topic to start with. And so let me ask you a few things, and you can kind of just jump in as things resonate with you or any thoughts you have on these.
Mm-hmm.
One of the first ones that the article pointed out was that the therapist lacks the specific training. Can you tell us a little bit about different styles? I know this is too short of an interview to really get too in depth in it. Maybe we'll talk about that another time, but kind of some of the different approaches that are out there.
Well, one of the things is it depends on who the client would be. So sometimes when you're working with a teenager, let's say, a therapist might just approach it as, well, this person is ready for talk therapy, and being in the room as an adult and doing talk therapy, your brain is different than if you're 14. But 14-year-olds can speak and communicate in the same way it feels like an adult can. So that therapist's approach for a 14-year-old versus an adult might not end up working out, because they might be expecting too much of that 14-year-old's brain in that role in terms of the talk therapy. In terms of just working with an adult, sometimes maybe you need to work with somebody who is very trauma-informed. Trauma-informed therapy is going to be different than somebody who's working with maybe just the depression or the anxiety that's coming up with somebody who maybe hasn't had a lot of trauma or impact of past childhood trauma in their life, or maybe even a current recent trauma that's come up that really puts you in a different headspace when you're talking about the issues. And there are a lot of different ways to work with a client in terms of your approach, but we try to make sure at Relate that your overall approach is what's called evidence-based, meaning that someone's done some amount of research around this to see if people do experience change, they're able to maintain motivation and gain a new awareness into the approach of their lives.
Oh my gosh, that's music to my ears. Evidence-based approach. You and I have talked offline about that. And that's one of the reasons I was so excited to talk to you today, is that we both take these very evidence-based approaches. For me, it's interesting too. A lot of times we don't always think about, we need to find somebody specifically for or trained in trauma if the patient or client is experiencing or dealing with trauma.
Right. Trauma often impacts so many of the reasons that people end up needing therapy. Behaviorally, people that are maybe in active addiction or who are experiencing even symptoms of ADHD, that lack of focus, concentration, some of those pieces that you could assign to that category also fit in that trauma realm. And being able to talk and work through that trauma might help them just be able to be more present.
Oh my gosh, that's really good to know. I'm going to, going forward, that gives me a whole new perspective on that. Sometimes it's so easy to just think ADHD is physiologically related and not related to some previous trauma, but that makes a lot of sense now.
There are a lot of assessment tools and ways we can see if someone has experienced high trauma, right? So we can say, this definitely, we don't want to discount ADHD as a possibility, but we also want to take into effect that, especially when you're dealing with maybe a 6 or a 7-year-old, somebody whose brain is really forming, we might want to take those extra couple months to have them work through play therapy and have an approach maybe that more involves their parents than just immediately placing them on meds.
Wow, cool. Okay, this one my wife tells me a lot about this one. This is kind of one of her favorites.
Uh-huh.
The client doesn't want to put in the work.
Therapists love to use that as an excuse too, right?
Oh,
Because I do think, the reality is that if a client is taking the time to come to see you, they're putting in some amount of effort, right?
fair,
And I
yeah.
don't want to discount that. I want to make sure that clinically, my team in particular, I understand sometimes people aren't ready to do the work and they're not able to do it, but I also want to make sure that we're creative, we're able to build that rapport first, we're able to get them in a space where they're ready to work. So for me, I don't like to have that hang out there too often with our therapists, because I think that although it does happen, the majority of people who are putting in time, energy, and money to be in therapy are at least attempting the work. But it's like anything, like exercise. We can say we want to do it. We could even show up at the gym. But until somebody really shows us what you do with those pieces of equipment, you might just run on the treadmill for 100 days.
Right. Or walk on the treadmill, right? Or
just walk. Yeah.
Yeah. Well, that's a great concept. That's a great approach to it too, is they are putting in the work by showing up there, by paying money. Sometimes they just need a little bit of reinforcement, it sounds like, or kind of an experienced therapist to help bring it out.
Right. A direction.
Cool. I like that one. Okay. We'll come back to that one. Ooh, the client is not realistic about their issues.
Well, that happens a lot with us as people, right? Because we often expect a lot from ourselves. When we decide something, we want it done. We want it right now. We want to accomplish it immediately. And the reality is a lot of times we're unlearning years and years and years of behavior, and consistency has been there, right?
Yeah.
So suddenly go and be consistent in something that is a change in your behavior isn't necessarily realistic. It doesn't just shoot up and you're doing amazing. It's going to go up and down, and you will potentially regress. And that's why it's important for us. It relates specifically. We see clients weekly, and then once we feel like they are able to maintain and meet some of their goals, we do what's called titrating, meaning the client doesn't come necessarily every week, but they don't just stop coming. There is time in between sessions for them to work on their own skills, and with the reality that there's going to be some regression.
Wow. Do you then see people come back for, in our minds, it's kind of like a maintenance, or do you see people then come back, say, as the date of a trauma's original occurrence comes near? Do they tend to return then once they've actually stabilized and worked through a lot of the issues?
Well, that might be one reason that they come back, is maybe that's a trigger, the date's a trigger. Another thing that can be triggering that people forget is a new trauma. A new trauma can trigger an old trauma. It can create that regression. You may have worked through the death of your mother, but you lose your job, and suddenly that feels the same type of space. And you feel that sadness, and you feel hopeless. And both of those traumas hit on the same type of narrative, but they don't really relate in terms of the issue.
Gotcha. Great point. Again, these are things that kind of like fall out of my, main view. So it's really good to hear them. The client and the therapist are not a good fit.
Mm-hmm. And that does happen. I think that the first way to address that from a client or a therapist perspective is to name it and put it in the room. We had a training actually a couple days ago around having difficult conversations with clients. And this was one of the conversations that we discussed as a team, is when do you directly talk to your client and put it in the space that maybe there's something here that's not working. It could be something in terms of identity, right? Like, I feel like, I'm a lot older than you, and maybe you don't feel like I relate to you because of that. Or maybe it's some of these other pieces, like maybe they really are just not in the headspace and ready to be there. Or maybe the therapist doesn't have the right tools or training in order to really reach them. But it is something that I think before someone just abandons therapy, that to at least have that conversation and say, I don't know if this is working for me, as opposed to some of the other excuses that I might get, like suddenly it's too far to drive.
Is that kind of a common, and I guess really my first question was, who initially initiates that conversation? Is it the client or is it the therapist?
Well, it depends. Sometimes the therapist is completely unaware that the client has that feeling. And I think in those cases, obviously it would be the client that then terminates and stops coming. And what we find sometimes, if maybe there's a therapist, particularly therapists that maybe are just starting out, they may have several clients that do that, where they see them a few times and then it doesn't work. And that's the work of the therapist, right? The therapist needs to decide, how do I approach this in the future? But otherwise, if the therapist feels like maybe there's a disconnect and they don't put it in the room, right, and don't share their feelings around it, they're likely just going to lose that other person as a client.
Gotcha. Yeah, and that's probably just a natural progression. I know for nursing and every other field, that's just kind of a progression in the growth and the career cycle of a provider, right?
Mm-hmm.
Okay, the client needs a higher level of treatment.
Well, you can feel this happening. If a client is talking through the entire session and you're doing a lot of management of the client, you're not really doing as much of the actual treatment, right? Like you're not doing treatment goals and you're not working on moving them forward. You're really just sitting in this space and making sure they're safe and okay. If that happens too frequently and you don't move through that, that means there is something else going on and they need a higher level of care.
Gotcha. This one I did not understand very well, and I'm really looking forward to explaining this. Transference and countertransference.
So sometimes that can be a good thing. Okay, so transference and countertransference is where maybe the client or the therapist reminds you of someone. Or there's some sort of things about them that you feel like you really connect with, but it doesn't really have anything to do with the relationship between the two of you, right? So those things can come up, and maybe it's related to the fact that you both have 3 huskies or something, but there might be some way that the two of you connect that maybe in a lot of circumstances could be a positive, right? But sometimes it can play out as a negative. If the person has experienced the same trauma that you have and the therapist isn't really good at dealing with kind of keeping up their own barrier and their own wall around their trauma, and there's too much self-disclosure then, and they're connecting too much around that, you're not really working on the client's goals then. Another way that this works is if I've had clients in the past who their previous therapist reminded them of somebody that was maybe abusive to them or had really been negative to them, and they just never could quite land in a space where they could be completely vulnerable.
That was one that first triggered, or first came to my mind was, gosh, if it was like a parent that was abusive, or that's where the trauma came from, and the therapist reminded you of that parent, or even a spouse or something like that, like that would be really difficult. But it's also interesting to hear if you have the same issues in life, that could be very difficult for the therapist to kind of relate to the client with as well.
Mm-hmm. And that is something that the self of the therapist work really has to cover. You know, therapists are human and they do have things that come up. But I also think that in the same vein, where this can be a negative and can stop treatment, it can also be a really positive tool for growth. Having somebody that reminds you of somebody that was not good to you, and that person is now safe and supportive, can really shift your perspective. And I think that can be nice as well.
2 really great points I heard in there. Therapists are humans as well, right? They're persons and they have their own lives that they're dealing with as well. So that's really important one that I want everybody to kind of take home, is that providers are people too. And the idea of healing by kind of communicating the same issues together, or growth together, or with a similar personality that might have been the trigger or the trauma from before. This one I thought was interesting. How does the client define success, or how do you even define success in therapy?
Right. And this can often be a problem between a therapist and a client, between the difference between partnering with a client and the role of the expert. You know, you have to find a balance when you're working with a client around those two things. You can't come in as the therapist and say, you know what, the real problem here is that you haven't dealt with the problems from your past. You know, that boyfriend that you broke up with 10 years ago is still haunting you.
Right.
If that client is not able to hear that and they're really wanting to focus on their relationship with their 7-year-old daughter right now, and you keep going back to this boyfriend and the way that this is triggering them, it can be very difficult for the client because they feel like you're not validating them.
Uh-huh. Gosh, and I hate to put you on the spot with this question, but is that a really difficult situation to work through? Are you able to say like, yeah, most of the time we're able to work through that? I guess it really depends on the patient, the individual patient or client, but is that sometimes just a brick wall that you hit?
Well, this is why the therapists that relate don't work in isolation, right? We are a team and we come together as a team and we talk through these things as a team, because I feel that this can be a huge barrier to treatment if the therapist doesn't stay a little more open-minded about where this work needs to go. One thing that comes up is patience. You know, that's one of the benefits of therapy that a lot of other professions don't have. If you're able to gain trust of a client and start to work on what they think needs to be worked on in this type of situation, you might get a chance to work on what you think they need to work on.
That's one of the great things about being able to see people for an hour at a time and on a weekly or near weekly basis. So that's great. My apologies. My phone's going off. I should have left that
You're a busy man.
off the hook. You are too. I know how it is. Okay. So these were the questions then. Those are kind of some of the reasons that therapy might not have worked. Let's talk about what you should do next. So I'm new to therapy. How soon should I expect to see results?
It depends on what you're coming in for, truly. What I always tell people is that within 5 or 6 sessions, if you and your therapist haven't been able to talk through a plan of what's going on and where you're at and what they think, then maybe that person's not a great fit for you. I often call it a thanks for sharing therapist. I feel that when someone's going into sessions and going consistently into sessions and all they're getting back is thanks for sharing, they're not really building on treatment. They're just going into vent.
Right. And that was actually the terminology that I saw on one of those was the one where it wasn't putting in the work. It was the client only wants to vent. So you kind of nailed it there. But that's great to quantify it, I think, for the audience especially. You know, think 5 to 6 sessions at least before you're really making a decision. Because I do want to make sure people give it a chance. What can the client do themselves to help make this more positive and to make it more effective?
Well, I think the first thing, and I know it sounds kind of trite, but when they come in, be really honest. You know, it's a confidential space for a reason. And sometimes it takes 10 to 15 sessions for someone to really share why they're in therapy or what they're really hoping to work on. And if a person comes in with the expectation that the therapist is just going to figure it out and they're not willing to get uncomfortable, then that could be a really big barrier.
That's a great one. And this is something, you know, I've been in nursing for over a decade, and it always boggles my mind that the general public doesn't feel comfortable telling us the truth. And it's generally, I'll figure it out or I'll find out one way or the other.
Right.
I'm not here to judge you by any stretch of the imagination. Just be honest. So these were some other ideas of when it doesn't work, you know, try a new therapist, make lifestyle changes. Some of the other ones were medication and medical management. When do you guys start thinking, oh my gosh, I should probably refer this patient out for medication?
Well, again, it is an age piece because we see kids as young as 2, you know, through adulthood. So I do think that younger kids, we really want to make sure that we work with their parents as well. If we're seeing that the child's not able to change through some of the treatment without working with the parents, then we would probably have another therapist within Relate talk to the parents, either for co-parenting or working on family therapy or that sort of thing. So for those younger people, it's really important in my mind that we make sure we look at the system before we would refer out to somebody for meds. But in terms of an adult, I think that there's a little bit of a difference.
Yeah, no, that's huge. I don't think anybody really wants to see a 2-year-old on medication, but I love this concept, and I would like to talk to you in the future about co-parenting as the other half of what I deem successful co-parenting relationship with my kid's mom. It's something that I really want our audience to be able to hear and learn from, and kind of progress in that.
Yeah, it can be done. It just
can be
takes
done.
work.
It does. Well, I know you have another meeting, Jasmine, but I wanted to say thank you so much for joining us today.
Yeah.
I hope to talk more with you in the future. Maybe we'll get you into our Denver Wellness Digest studio. And for those of you out there, I have links to the articles below on why therapy may not have worked with you, a link to Relate, family therapy and counseling. And if you like what you saw, hit like and subscribe below. All right. Thank you, Jasmine. Have a great day.